Hello, my name is Rathi Rajendran. I'm a consultant for Moorfields Eye Hospital who performs cataract surgery. You are watching this video as you have been referred for cataract surgery or are interested in finding out about cataracts. In your eye, there is a natural lens that as you get older, it becomes cloudier and stiffer. Sometimes people can develop changes like this at a younger age, but is usually for another cause, such as they were born with it in congenital cataract, or for a metabolic or a drug-related cause, such as diabetes changing in the lens, or steroid-induced, or they may have had an injury to the eye or surgery on the eye. The most common cause of cataracts, however, is the aging process. Once the lens starts to get cloudier and stiffer, you may become more and more short-sighted and your vision blurred. This is when people will start to call it a cataract. The initial management of cataracts is to obtain or update your glasses from the optician. You may find that as you get older you need to do this more frequently. At the point that the optician cannot improve your vision any further with glasses or contact lenses, they will refer you to the eye hospital, to the cataract clinic, to be considered for cataract surgery. The operation itself involves a local anaesthetic where we just numb the eye and you shouldn't feel any pain. Occasionally people will request to have sedation, which is an injection through the hand, or rarely they will have general anaesthetic where they need to be put to sleep for the procedure. But this is usually because they have not been able to stay still for a duration of the time. The operation takes on average 20 minutes. During this time, once the eye is numb, we make very small incisions into the eye. We make a hole in the bag that holds the cataract, which is called the capsule. Once we've got to the cataract, we break it up with ultrasound and then we remove it. We then insert an artificial intraocular lens which stays in the bag for life. The lens that we provide on the NHS is of one focal power, so we correct you for either one distance or the other. This means that if you aim to have your distance in vision improved, you will need reading glasses after the operation. If you choose to remain short-sighted so that you can see close, without glasses, you will need glasses or contact lenses to see in the distance. If you have an astigmatism, your eyeball will be more rugby ball shaped than football shaped naturally. This means a standard monofocal intraocular lens may not fully correct the vision, and you may need glasses for distance and near after the operation. Toric intraocular lenses are special lenses which aim to reduce your astigmatism when inserted. They are suitable for patients with a regular astigmatism, and you may be eligible for them on the NHS at our Moorfields sites if your astigmatism is 1.75 diopters or more. Some people wish to be less spectacle dependent and may choose to have monovision if both eyes need operating on or if they have good vision in one eye. This means that one lens will be for correcting your eye for distance and the other eye will have a lens for near vision. This would mean that you should hopefully have good distance vision with one eye and with the other be able to see the menu or read messages on your phone. You will, however, still need to wear glasses for longer periods of reading and for night driving. The NHS's primary focus is to aim to remove the cataract and not to guarantee spectacle independence. Privately, there are available other types of lenses, including multifocal intraocular lenses, which aim to improve distance and near vision. If you chose to go privately, you would need to arrange the review privately by yourself, and some of the tests may be repeated. If you continue to go privately, you should cancel your NHS appointment. Unfortunately, there is no facility to top up on the NHS to have the private intraocular lens fitted during an NHS operation. Cataract surgery is one of the most commonly performed surgeries, with 330,000 operations being performed each year. Serious complications are uncommon, and visual outcomes in over 90% of cases are excellent. Any operation, unfortunately, has a risk, And although cataract surgery is straightforward, 1 in 1,000 people can get a problem which causes their vision to be significantly permanently reduced. 1 in 100 may need further surgery if a complication happens at the time of surgery requiring it. 1 in 20 people may have a complication that can be rectified at the time of surgery. In 1 in 10 people, the bag that holds the lens may get hazy. The cataract will never regrow, but the bag may be hazy and give the feeling of blurred vision. If you do get blurred vision from this, the treatment is a simple laser procedure which we can arrange for you. Cataract is a normal aging process in life, and so it doesn't need to be operated on unless the vision is affecting you significantly. If you drive, you may also need to make sure that you are at a level to have driving standard. You could speak to your optician for them to check whether you would need to have surgery to maintain your driving standard if you want to continue to drive. We can also have that discussion in the cataract clinic if you feel your vision is troubling you. Thank you for watching the video, and I hope that you know more about cataracts now and the cataract surgery and the risks and benefits.